Okay, so this exercise is to work on opening up the front of the hips. So we're looking at a positional isometric to lengthen through the psoas and maybe through the iliacus just a little bit. And so what we're going to look at is coming into an A-frame stance so that the feet are just about 1.5 feet apart. You want to turn your back foot out just a little bit, and the hope here is to open up the pelvis just a wee bit as we get into the position. You're going to start by tucking your hips underneath you. So you want to get that scoop of the pelvis here, so you'll feel the glutes fire up just a little bit, and then you want to bring that knee back. So if it bends when you tuck, try to find a balance between tucking and then bringing the knee back so that you feel some activation back here and some stretch up in here. Okay, so you want to think about getting that tuck, bringing that knee back, and feeling that length through the back. So almost like you're reaching your heel down towards the ground. Then you're going to very softly bend that front knee, focusing on maintaining that tuck and finding that length through the front of the hip and maybe a little bit of stretch right here in the deep part of the hip here. You're going to hold this position for about 2 minutes, just trying to breathe through that space, breathing into the belly, up into the chest, and then out nice and slow. All the way, feel the side abs engage just a little bit. Breathe in again, focusing on trying to push that breath down into that space where you feel the stretch. And out. Once again, all the way out, feeling the side abs engage. Every time you inhale, see if you can capture a little bit of that space just a little bit more by maybe leaning a little bit deeper, bending the front knee, bringing the leg back underneath you, or even tucking the pelvis. Trying to just find little ways to increase the amount of stretch that you're getting in there within a tolerable limit. No pain, but definitely wanting to feel some tension. Okay. After the 2 minutes are up, you're going to perform the positional isometric. So you're going to take a big deep breath in. And on the exhale, I want you to think about driving your whole foot down into the ground. So front and back, and you're going to start to feel activation around the whole pelvic area. Then I want you to think about trying to pull your foot forward against the floor. So you should feel the quad engage, feel the hip flexor engage, and you may even feel that up into the abdominal area a little bit here. With your foot turned out, since we're trying to activate this iliacus just a little bit, I want you to also think about trying to turn your big toe into the right side in this situation. Okay, so you're trying to rotate as you pull forward. At the same time, you're going to start to build that tension by pulling the right leg back or the right heel back, specifically into the ground, like you're trying to squeeze the floor together. So you're working on rotating, pulling forward, and then pulling back over here on the right side. You're going to hold that squeeze for 5, 4, 3, 2, and then you're going to ramp that down nice and slow, feeling the muscles relax. Keep your position, don't come out just yet. Take a breath in. And on the exhale, really drive that heel back down into the ground on this long leg here, finding that extension, tuck the pelvis, feel everything lift up here, glutes and hamstrings activate. And since we're trying to open it up, you're going to screw your foot out, pulling your heel in, pushing your pinky toe out as you squeeze back and tuck that pelvis, trying to get deeper in there. Once you've got that for about 5 seconds, you're going to bend that front knee, holding that space, keeping that knee straight, and sinking into that position and holding with nice big deep breaths, trying to kind of relax into the stretch again. Okay, so you'll perform that one more time on that side, and you'll switch over and repeat.